So, shall we? I'm going to start now.
Yeah.
Okay, so are you ready? Okay. So, welcome. So, last time we're able to discuss about the neurotransmitters and their functions. So, I think we are going to connect as of this time now. The objectives is we have the components of somatic motor control system. So, we are going to discuss the three-tier system, the low, middle, and higher level. How does it control? Skeletal muscle with the effector organ of the somatic motor system. And then reflex activity, regulations of posture, and then the vestibular apparatus and equilibrium. That will be in part 2. So here, if you can see now, this with just a figure, at least you can imagine how does it goes, and then how does it skim the picture. So when you will say effector organ, this is the skeletal muscle. So when somebody will say the skeletal muscle, this is the same with effector organ. And then the muscle activity is the one that will decide the rate and pattern of discharge in motor neuron. So you remember how many trillions of neurons found in the human body. So here, this particular neuron, which is the motor neuron, now the muscle activity is the one that will decide how much the rate and pattern. So that's why in nursing, now when you are going to do physical assessment, you are going to count up how much the rate, how much the pattern, and then especially if you are going to see the vital signs of the baby. No, somehow it's hard for you to hear. So all you have to do is to observe the up and down of the stomach, no, the abdominal area, so you can know the respiration. So muscle activity, no, this is the one. So when you say motor unit, this is a single motor neuron and muscle fiber that it innervates. So when you will say innervates, now that will give the dynamic, the dynamo, the movement or the vibration, the motor unit. That's why when you will say motor, now what have you in mind in motor? Now something that will move, now a vehicle. So motor unit. So motor neuronal pool, now when you will say all motor neuron for a given muscle. So the term is motor neuronal pool or neuronal pool. So when I'm going to ask you, okay, what particular, no, that will all motor neuron for a given muscle. Now you're going to answer me, okay, that is a neuronal pool. It's not effector organ. We'll say skeletal muscle is so-called what? Effector organ. Muscle activity, rate and pattern, motor unit. This is a single motor neuron or muscle fiber, a unit. Now, next is we have the lower motor neuron and final common pathway. So later on, I'm going to show you now the organization of how the motor pathways goes. No, we have the final common pathway or alpha. Now, motor neuron and motor nuclei of cranial nerves. So when somebody motor neuron and motor nuclei of cranial nerves. So how many cranial nerves do we have? 12. Now, so that is what we call as lower motor neuron and final common pathway. Now, next is we have, now, what is the somatic motor activity? So the terms used when there will be somatic motor activity, now you will be able to read and hear, now doctors will say, voluntary movements. So when you say voluntary movements, you are going to move now within your volition or because you want to, you like to. So this is learned by doing and performance. Now, and then it will improve with repetition. The same also, now say for example, the learning domain, knowledge, skills, and attitude. In fundamentals, nurses, when you are going to be taught by your clinical instructors, now you will be taught in the theory first, then after Now you are going to go in the skills laboratory. So this is the time now you'll be observed now how you are going to behave, how you're going to move. Now by presenting or making a return demonstration. Of course, the demonstrations will be given the clinical instructor first. They're going to discuss now the basic procedure step by step. Then after you observe, now you are going to make your return demonstrations. So in what way now you are going to improve now your movements? By repetition. So you are going to do it again now in order to improve. Now that is what we call as voluntary movements. This is learned by doing, and performance improve when there will be repetitions. So reflex responses. Okay. So when you will say reflex responses, I will give you an example. We have the grasping reflex of a baby. Now, how months old? We have the startling reflex. Now, when you will say reflexes, now these are the activity that will automatically, okay, be manifested by somebody. Now, when you are going to do these reflex responses. Now, rhythmic motor activities. This is initiated and terminated voluntarily. So that is what we call as rhythmic motor activities. When you will say control of posture and equilibrium, equilibrium meaning balance. So this is what we call as goal and directions oriented. Now with what we call as phasic movements. So when you will say a movement now step by step. Now remember, now when you are going to study the developmental stage of a baby, now there are movements that will come, that will be manifested by day, by week, by month, and then after a year. Now there will be. Same also with the speech. Now, same also with the movement. Now that is control of posture and equilibrium. So that is the term. Next is we have the medial versus lateral motor system. So when you say medial motor system, these are the anterior corticospinal tract. Now later on, now there will be a picture. Corticobulbar tract. Now when at least you will be familiar when you're going to say corticobulbar tract, lateral and medial, vestibular, spinal tract. We have the reticulospinal tract. These are under the medial motor system. Now, in the lateral motor system, when you will say lateral, what does it mean? From side, okay? Lateral. Lateral movement. Lateral motor system. Now, this is what we call as lateral corticospinal tract. Now, we have the rubrospinal tract. Now, these are the tract. Now, corticobulbar tract. Now, found in the lateral motor system. So, medial comparison between the lateral motor system. These are the tract you can see, or you can now observe when there will be when there will be images presented and shown. Of course, nurses, now you are not expected really now when you are going to do this, because surgeons, doctors will be the one, but at least because now of knowledge, it will enhance your competence in performing procedures, because you know what's the basic anatomy and physiology behind what you are doing. So next is we have the control of somatic motor activity. Now, in the control of somatic motor activity, we have the 3-tier system to control. Now, this is what we call as the highest level. Now, cerebral cortex here. Now, this is used for generation of ideas and giving motor. So, in a motor system, now, we can find this cerebral cortex in the brain. So, particularly in the frontal. Now, here, when you say, what kind of level or tier system now in the cerebral cortex that will generate ideas? Now, say for example, if you are going to read, if you will be asked, you will be thinking of. So that is what we call the highest level of your cerebral cortex. Now that will generate idea from your brain. Okay? So, generation of ideas, now that is highest level. Now, when you will say as part of the cerebral cortex now, we have for supervising, that is what we call as the middle level. If I'm going to ask you differentiate the three-tier system of control, now there are three. Now, the highest, this is in charge for the generation of ideas, giving of commands. The middle level is for supervising, and then the lower level is the execution. So that's why before you are going to execute, now the motor system will do the execution movement. Now everything is censored, edited, and learned, and meanings will be interpreted from the cerebral cortex, contextually in the part of the brain. And then it will give signals the meaning, and then it will go to the middle level, supervising, and then lower level, and then you are going to do the what we call as execution of movements. Okay? That is the three-tier system now to control, no, of somatic motor activity. So if I'm going to ask you, okay, differentiate or discuss the three-tier system, you can answer me now. Generation of ideas, what? The highest level. For supervising, middle level, and then for execution, that is lower level. Okay? So here, we are going to identify the role of sensory receptors in motor control activity. Okay? So, these are the proprioceptors in skin. Okay? So, muscle and joints will give feedback, and then it will adjust motor commands. So, that is the role of sensory receptors. So, say for example, if you are going to see a stimulus that is blown by the wind and then a piece of paper, now you can see by your eye why your eye was able to see, because of the stimulus that emit now in your eye part, cornea, retina, etc., to the optic nerve, and then that nerve now will send all the neuron system will send signals to the brain, and the brain will be the cerebral cortex and the brain will be the one to formulate ideas. Hey, the one that you have seen that's a color red now paper. And then since you have seen that color red paper, it will go to the middle level part of motor, and then for the execution, and then it will give the motor signal, and then with the afferent neuron now will make the muscle move, and then will make the skeletal move, and then you are going to go, walk, and then pick up that piece of paper which is color red. Okay? So, have you get my point, that example I have? Did you understand? Okay. Did you understand? The example? Okay. So, is it clicking? So, I'm just showing you the illustration. Imaginative now because we're online. So, here, that is how it is. Now, adjust motor commands, that's why. Now, we are going to study on the overview to study motor control system. Now, we have the components of somatic motor control system. Now, we have the skeletal muscle. Remember, skeletal muscle, or also called as the effector organ. Okay? Effector organ is also called as, okay, skeletal muscle. Reflexes, regulation of posture and equilibrium. Okay? So, equilibrium, balance. That's why, remember, nurses, when you are going to do your PE, physical examination, now you are going to command your patient, okay, can you close your eyes, and then your legs, your right and your legs straight, and then stand straight, and then close your eyes, and then do walk. Because you are trying to find out what is the balance, what will be the posture of the patient when they are going to close your eyes. Because closing your eyes, it will make your movement sway. So the balance now, the one controlling the balance is the what we call as the motor control system. Of course, now in the brain. Now next is we have the highest level of motor control, the middle level, the lowest level, which is the execution. Okay? So the highest level of motor control, now cerebral cortex, now particular specific part of the brain, and then the motor cortex. Okay, this is the brain. Now you can find this, the cerebral cortex, motor cortex, and then we have the descending motor pathways from motor cortex. So later on, I'm going to show the pathways, organizations of this motor. And then we have the cerebral cortex or motor cortex. Now, this is the area, okay? This is the area of motor cortex, and then we have the primary motor cortex. Now, as I said, now this cortex, cerebral, primarily, now you can find this in the frontal lobe. How many lobes does your brain have? 4. Frontal, occipital, parietal, temporal on the side. So, this primary motor cortex, number 4, now frontal lobe within precentral gyrus. Okay? So, in the cortex, there are part, now the precentral gyrus. We have the premotor cortex. We have the number 6, 8, 4, 45. Now, anatomically, now, I don't require you to memorize this or something. So, at least you have read, you have seen that one. You have the familiarity of, oh, those were the cortex. Premotor, precentral gyrus, that is within the frontal lobe. So, when you say frontal lobe, now most of the part of the brain, now they are in charge for the control of the motor system. So, we have the supplementary motor cortex or the medial surface behind primary motor area. Now, what are the functional rule of motor cortex? So, we go deeply now on a particular motor cortex. So, primary motor cortex has number 4. Now, this is used for the executions of movement. So, we have the premotor cortex. Where's the premotor cortex here? Okay. So, we have the number 6, proximal and axial movements and skill. Number 8, this is used for the coordination of eye movements. So meaning if you are going to blink, if you are going to wink, if you are going to roll your eyes left and right, it's number 8 part of the motor cortex in the cerebral cortex. The 44, 45 number, coordination of muscle, of speed. So the speed of the muscle movement. Now if you are going to rotate your head left and right, now we have the head rotation. The premotor cortex is the one in charge for that one. Premotor cortex within the cerebral cortex. Okay? So, we have the supplementary motor cortex. Now, responsible for generating ideas for movement. So, when I will say what part of the cortex now, of the cerebral cortex, now which is responsible for generating ideas for movement, the answer will be the motor cortex. When I will say a tire system, now what level that will generate ideas? Now it will be the...
Doctor, can you increase your voice, please?
Yeah, it will be the highest level. Okay?
Again, doctor, I
Okay.
didn't hear you.
To say for example, if I'm going to ask you, okay, to evaluate what particular cortex, now part of the brain which is responsible for generating idea for movement, so motor cortex. When I'm going to ask, now differentiate the 3-tier system, now what tier system level which is responsible of generating ideas, it will be the highest level. Okay? So, for you to understand, now we have the plasticity property of motor cortex. Motor cortex is learned by doing. Okay? So, meaning if you are going to understand now everything you will know, now you will learn by doing. If you are going to learn by knowledge only and then you're not going to do it, now the tendency, what knowledge you may have, that will be eliminated or that will not be retained, it will go away from your brain. So as what we've said, in order now to improve your performance is you are going to do what have you learned, right? So what you learn in the theory, what you learn in the classroom, you are going to do in the laboratory, and then what are the skills you develop and improve Now that will become your attitude and behavior if you are going to be in the clinical, if you will be working in the hospital. So you know it already by doing and doing repetitions. Now, performance improve now with repetition. That is what I said. So this plasticity property of motor cortex, this is confirmed now when the doctor will order, okay? Because maybe the doctor is suspecting this patient is suffering from vehicular accident, so maybe there will be contusion or there is what we call as hemorrhage inside the brain or something. This will be found out because his movement were being affected. Now, example of the diseases that will affect movement. Now, the what we call the CBA, cardiovascular accident. We have the hypertension. So, PET scan, this is the procedure that the doctor will prescribe, or MRI. So, to find out what are the normal structure or what are the what we call as impairment structure now that can be seen through PET, because this PET will display the detailed extent of the picture of the brain. Now, next we have the topographical representation of motor areas and cortex. Okay, so that is just a picture. So what the brain sees now, sensory motor. Now that is what we call as motor homunculus is the one. Now, so for example, now you have sensed something, you have smelled something. Now, if you have smelled bad, what will you do? You are going to wear face mask. You are going to close your nose, or you are going to, okay, not breathe partially and then go away from that place. So that will become, now that is the motor activity that will tell. Now, okay, you're going to behave such a way based from the senses, and then based from the brain interpretation, and then from that, now you are going to behave because of this motor activity. That is the motor homunculus. Okay? So, next is, we have the descending motor pathways from motor cortex. So, descending from up, going down. So, we have the pyramidal tracts. Okay? We have the extrapyramidal tracts. And then, we have the criteria, no? Criteria to describe the tracts. So, first now, when we are going to describe the criteria of every tracts, for example, the extrapyramidal tracts, you are going to find out now what is the synonym, what is the origin, the course, the crossing, the termination, and then the function of the tract, and then you are going to view a bit now what is the physiology behind where the tract can be found. Now, this is the part 1. Now we're going to continue part 2 next.